Another way to not kill patients. Let's say your patient needs a feeding tube inserted, and you're going to put a nasal one up their nose. It goes down into their throat and into their stomach for whatever reason. And let's say they're a trauma patient. You have got to check to see if they have any basilar skull fractures, and I'm going to show you why. With my guy. Now, I don't have an actual feeding tube, so I'm just going to show you with my lovely power cord. But let's say you're putting, your tube up in their nose, yada, 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 and they're unconscious, they can't tell you anything, and you go and check an x-ray. Well, what's supposed to happen is we're supposed to go down here, right? Like go down, this is what's supposed to happen, and we go all the way to the stomach. If we have fractures up here, you could put this hard tube up into their brain, like this. This. And also, like this. You see that tube? That's a feeding tube in someone's brain. Okay? Therefore, if you have a patient who had any surgery up here, if they were in a trauma, like a car accident, and you get an order for a feeding tube, which happens all the time, we have got to make sure that it's intact up there before we insert anything into their nose.